Last night you went to bed feeling completely fine. No chest pain, no dizziness, no warning signs of any kind. You closed your eyes, got your 7 or 8 hours, and woke up this morning. But here is what I need to ask you. When you woke up, did you have a dull headache? Did your legs feel heavy? Did your mind feel foggy even after a full night of sleep? Did your heart feel like it was beating a little harder than normal in those first few minutes after waking? Most people blame age for those symptoms. They think that's just what mornings feel like after 60. It is not. What I'm about to tell you has nothing to do with your diet, nothing to do with your medications, nothing to do with how much you exercise. It is about something you do every single night without thinking about it, something that is actively influencing how well blood reaches your brain while you sleep, and something your doctor has almost certainly never once mentioned during any of your checkups. The position your body is in while you sleep is either protecting your brain and heart, or quietly putting them under stress. For 7 or 8 hours, every single night, 365 nights a year. And here is the number that should stop you cold. Stroke risk peaks in the morning hours. Research shows a 49% increase in stroke risk between 6 a.m. and noon. That is not a coincidence. What happens during the hours before that window? How your body was positioned, how well your blood was flowing, whether your brain was actually recovering or just getting through the night, directly determines how vulnerable your cardiovascular system is when that morning surge hits. I'm Dr. Danzy, and today I'm going to walk you through the sleeping mistakes that are silently increasing your stroke risk after 60, and the 2 positions that could protect your brain starting tonight. Stay with me, because the most dangerous mistake on this list is one that almost every senior does, and most people would never guess it. First, I need to give you the context that makes everything else make sense. When you were in your 30s and 40s, your blood vessels were elastic, flexible. Even if you slept in a strange position, your cardiovascular system quietly corrected for it. You woke up with a stiff neck and that was the end of it. But here is what changes after 60. Your arterial walls begin to stiffen. The small vessels feeding your brain become less flexible. Your blood pressure regulation system, the mechanism that keeps everything balanced through the night, becomes slower to respond, especially during sleep. Healthy sleepers experience a natural 10 to 20% drop in blood pressure during sleep. This is called the overnight dip. It is protective. It is your body recovering and repairing. But if your sleep position is compressing the wrong vessels, restricting blood flow, or tilting your circulation in the wrong direction, that protective dip gets disrupted. And what fills that gap is cardiovascular stress your body was never designed to handle for 8 hours straight. Now let's talk about the mistakes. Mistake number 1, sleeping completely flat with no head elevation. This one surprises people. Sleeping flat sounds healthy. Spine aligned, body horizontal. Mattress companies market it as ideal. But here is what actually happens inside your body when you lie completely flat after 60. Blood does not distribute evenly the way it did in a younger body. Without gravity working in your favor, cerebrospinal fluid, the fluid that cushions your brain inside your skull, begins to pool. Intracranial pressure edges upward. The tiny vessels in your brain that are already managing years of gradual wear are now under slightly more pressure than they should be, for 8 hours straight, every single night. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation of just 15 degrees led to measurable improvements in intracranial pressure and nighttime blood flow dynamics. Here is the symptom most people completely misread. You wake up at 3 a.m. with a dull, throbbing headache, maybe behind your eyes, maybe at the base of your skull. You think it is just aging, you drink some water and go back to sleep. But that headache is your brain signaling that the pressure inside has been building for hours. Not a normal headache, a pressure headache, and there is a difference. The fix is simple. Elevate your upper body by 15 degrees, not just a pillow under your head. The entire upper torso on a gradual incline. A wedge pillow works well, an adjustable bed frame works even better. I'll tell you exactly how to set this up safely in the solution section. Mistake number 2, stomach sleeping. This one feels harmless. You're not putting weight on your heart. You're not compressing your lungs from the front. It's just lying face down. What's the problem? The problem is your neck. When you sleep on your stomach, you cannot breathe face down into a mattress. So you rotate your head to one side, the same side, every single night, because that is what creatures of habit do. Now think about what that means structurally. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours. And running along the sides of your cervical spine, the bones of your neck, are two arteries called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the regions of your brain responsible for balance, breathing regulation, and coordination. When your neck rotates significantly to one side for prolonged periods, these arteries become kinked. Think of stepping on a garden hose. Flow does not stop completely, but it becomes restricted. And restricted blood flow to your brainstem for 8 hours, night after night, year after year, accumulates in ways your body cannot simply absorb. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity, and there is a second problem with stomach sleeping that almost nobody mentions. Your rib cage is pressed against the mattress all night. Your diaphragm cannot fully descend. Every breath is fighting against compression. You never reach the deep restorative breath your lungs are capable of. Lower oxygen per breath, restricted artery blood flow, both happening simultaneously. For 8 hours, at 35 your body compensates. At 68, with any degree of cardiovascular history or hypertension, this is a cumulative problem building silently in the dark. Are you a stomach sleeper? Have you been doing this for 30 years thinking it was fine? This is important information. Your body has been compensating, but compensation has limits. Mistake number 3, stacking multiple pillows under your head. People do this for real reasons. Acid reflux, sinus drainage, breathing difficulties, snoring, and a small amount of elevation genuinely helps some of these things. I am not dismissing that, but here is what happens when the elevation becomes excessive. Your head gets pushed forward, your chin tilts toward your chest, that forward bend of the neck. Clinicians call it cervical flexion, compresses the same vertebral arteries we just discussed, but this time from the front. And there is a third vessel that gets overlooked in this conversation, the internal jugular vein. This is your brain's primary drainage pathway. It carries used, deoxygenated blood back down from your brain toward your heart. When your neck is bent forward excessively, that drainage pathway becomes partially obstructed. Blood drains less efficiently. Pressure inside the skull builds slowly. Your brain's ability to clear metabolic waste overnight becomes compromised. You might recognize this as that heavy, foggy feeling the next morning, the frustrating experience of sleeping 8 hours and waking up feeling like you barely slept at all. You are not lazy. Your brain may have been waterlogged overnight because the drainage was blocked. The correction is one pillow, one properly contoured pillow that supports the natural curve of your neck without forcing your head into an angle. Many people report their morning headaches disappear within a week of this single change. One pillow, not 3, not 4. 1. Mistake number 4. Right side sleeping with any cardiovascular history. Side sleeping is generally considered one of the better positions, and for many people it is. But the direction you face matters far more than most people realize. Your heart sits slightly left of center in your chest. It has a natural orientation. When you lie on your right side, gravity pulls your heart slightly away from that optimal resting position, and your body weight compresses the right side of your torso where the inferior vena cava runs. The inferior vena cava is one of your body's largest veins. Its entire job is to return blood from everything below your waist, your legs, your abdomen, your organs, back up to your heart. When you compress that vein by lying on your right side, that return flow becomes restricted. Your heart has to pull harder just to fill each chamber properly. For a healthy person, this is compensated for easily. But for someone over 60 managing borderline heart function, mild hypertension, or any cardiovascular history, Your heart is already working close to its ceiling. Adding nightly resistance is like running your car engine 10% harder every single night for years. The cumulative wear is real and it is silent. The European Journal of Heart Failure found that patients with heart failure naturally and instinctively avoided right-side sleeping. Their bodies had detected the strain before their minds consciously identified why. If you are a right-side sleeper, your body may already be telling you something. Are you waking up with your heart feeling slightly unsettled, feeling slightly breathless in the morning? Does this happen to you? Mistake number 5, the fetal position with knees pulled tight to the chest. For many people, especially women over 60, this is the default comfort position. It feels warm, protected, like the body is wrapping itself in a hug. But 3 things go wrong simultaneously. First, your lungs are compressed. The rib cage cannot fully expand. Every breath is shallower than your body needs. Blood oxygen saturation dips incrementally with every breath across a full night of sleep. Second, the blood vessels running through your hip joints and behind your knees get bent and partially compressed. Circulation to and from the lower limbs is reduced. If you already have swollen ankles or poor leg circulation in the evenings, this position makes both significantly worse by morning. Third, your neck is flexed. All of the same vertebral artery and jugular drainage concerns we already discussed apply here, just through a whole body version of the same compression pattern. Research in respiratory physiology documented that sustained spinal flexion during sleep measurably reduces tidal volume, the amount of air inhaled per breath. Multiply even a small reduction across every breath in an 8-hour night, and you are talking about significantly less oxygen delivered to already aging brain tissue. If this is your position, the adjustment does not have to be dramatic. A body pillow between your knees, a slight opening of the hip angle, small change, real and measurable improvement. Mistake number 6, eating a large meal or drinking alcohol close to bedtime. This is the most socially common mistake on this entire list, and it is the one that amplifies every other problem we have discussed. You finish dinner at 7:30, maybe a glass of wine while watching television. Bed by 10. That sounds like a perfectly normal evening for millions of Americans over 60. Here is what is happening inside your body while you sleep after that scenario. After a large meal, your body reroutes significant blood volume toward your digestive system and away from your brain. In younger bodies with full arterial elasticity, that redistribution is seamlessly managed. In older bodies with stiffer vessels and a slower autonomic nervous system response, this shift can create transient drops in cerebral blood flow, moments where your brain is subtly undersupplied. At night, while you are lying down, with no way to know it is happening. Now add alcohol. Alcohol is a vasodilator. It relaxes and widens blood vessels. Blood pressure drops. Your body senses this and compensates by constricting vessels and raising pressure again. Blood pressure oscillates up and down throughout the night, and in vessels already managing some degree of stiffness or plaque, that oscillation stresses arterial walls in ways that accumulate over years. The American Journal of Hypertension found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural nighttime blood pressure dip that healthy sleepers experience. Without that protective dip, overnight cardiovascular strain increases meaningfully. Have you ever woken up at 2 a.m. with your heart hammering, sweating slightly, feeling unsettled in a way you couldn't explain? You thought it was a vivid dream, but what you may have experienced was your vascular system trying to stabilize itself through a wave of pressure fluctuation it was not equipped to handle smoothly. The solution is straightforward. Stop eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. Take a gentle 15-minute walk after dinner. Not exercise, just movement. That simple act normalizes blood sugar, begins digestion, and gives your cardiovascular system a chance to settle before you go horizontal. Now let me give you what actually works. The best sleeping position for your brain and heart after 60 is left side sleeping. When you sleep on your left side, gravity works in alignment with your heart's natural orientation. The inferior vena cava, that critical vein returning blood from your lower body, runs on the right side of your spine. Left side sleeping takes compression off that vein entirely. Blood returns to the heart freely. Your heart works less hard. Circulation stabilizes through the night. But here is the discovery that genuinely changed how sleep researchers think about position. Scientists identified a system called the glymphatic system. Think of it as your brain's overnight cleaning crew. While you sleep, cerebrospinal fluid pulses through the spaces between your brain cells and flushes out metabolic waste, including the amyloid proteins most prominently associated with Alzheimer's disease. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when you sleep on your side, and left side sleeping appears to offer the best drainage geometry based on the brain's natural symmetry and the direction of cerebrospinal fluid flow. This is not just about tonight's circulation. This is about whether your brain is adequately clearing the waste products that over decades accumulate into cognitive decline. If you have never been a side sleeper, use a full-length body pillow to support your front. It prevents you from rolling. Put a pillow between your knees to keep your spine neutral. Give it 7 days. Your body will adapt faster than you expect. If side sleeping is truly not possible due to shoulder pain, arthritis, or decades of back sleeping habit, elevate your entire upper body 15 to 30 degrees on a gradual incline. A wedge pillow, an adjustable bed base, not pillows stacked under your head, the entire torso elevated on a slope. This uses gravity to assist blood return, reduces intracranial pressure pooling, keeps your airway more open, and improves oxygen delivery through the night. Add a small pillow under your knees to maintain your natural lumbar curve. This is what sleep researchers call a zero-gravity posture, and it distributes pressure evenly across your entire body. One woman I want to tell you about was 67 years old. She had been waking up every morning with a headache for 2 years. Her doctor told her it was tension. She had been a stomach sleeper her entire adult life. She also ate dinner at 8 p.m. every night and had a glass of wine while watching the news before bed. Nobody had ever connected those 3 habits to her morning symptoms. Nobody had ever explained what was happening inside her vertebral arteries, her intracranial pressure, her blood pressure oscillations through the night. When she made 2 changes, switching to left side sleeping with a body pillow and moving her dinner to 6 p.m., her morning headaches were gone within 10 days, not reduced, gone. Her morning blood pressure reading dropped by 11 points within 3 weeks. Same medications, same diet otherwise, just position and timing, not a miracle, a mechanism corrected. Here is what I want you to do tonight. Just one thing. Pick one change from this video and implement it tonight. Switch to your left side with a body pillow. Elevate your upper torso on a wedge. Stop eating 3 hours before bed. Replace your stack of pillows with one contoured pillow. Any single one of these is not a small thing. It is a consistent nightly intervention that compounds across weeks, months, and years of sleep. Now I want to hear from you. Drop your age in the comments right now. Tell me where you are watching from. And tell me this, are you a back sleeper, a side sleeper, or a stomach sleeper? And after watching this video, which change are you going to make tonight? I read every single comment. Everyone. If someone you love is waking up with morning headaches, morning heart pounding, or unexplained fatigue after a full night of sleep, send them this video. They deserve this information, and they are almost certainly not getting it at their doctor's appointments. I'm Dr. Danzy. Subscribe to Dr. Danzy's Senior Health Tips, and I will see you in the next one.